important. I mean, just one of the diseases that they're realizing now that adequate amounts of sun as a child is vital for are the autoimmune diseases, MS, for example. If children have excellent amounts of vitamin D before age 12 to 15, their incidence of multiple sclerosis is very much lower.
Really?
If you see a map of the United States with the different latitudes, and our highest latitude, we have a much higher incidence of multiple sclerosis for that reason, because children aren't receiving enough sunshine. But I think you're right, particularly because of her skin type and that she has red hair, when she has had a good amount of sunshine, 15 to 20 minutes, put on her sunscreen so that her skin will be protected.
It's important to remember that one sunburn doubles your risk for skin cancer. So avoid having that sunburn, but don't avoid sunshine. Sunshine is very important. Not only does it help with cancer prevention, and it's the big three that we really get benefit in. Prostate cancer in men is markedly reduced. According to one study, 60 to 70% reduction in prostate cancer risk with adequate vitamin D levels. Colon cancer also markedly reduced, and breast cancer in women. And you can look at those maps again, and in the Northeast the levels are higher than they are in the Southwest, time and time again, relating to sun exposure. So while we want vitamin D from the sun or from our food, but preferably I think from the sun, because our bodies control it automatically so we don't get too much. We don't want to get the burns so that we get the skin cancer. That's the problem. And interestingly, if you take someone with fair skin, they need much less sun than if you take someone with dark skin. Blacks or men are often have a higher risk of prostate cancer. Why do we think that is? Because it takes them longer to absorb enough sunlight to make adequate vitamin D levels. Where if you have a very fair-skinned person, it takes a shorter amount of time. You want to avoid a burn regardless of your skin color, but the darker your skin, the less likely you are to burn, the more amount of time it takes in the sun to get adequate vitamin D.
So for those of us in our younger years who used to, slather on the baby oil, we need to be mindful and we need to be careful. But what I hear you saying is that we also need to get vitamin D.
Absolutely. And one research paper that recently came out was fascinating, particularly to me on the subject, because it said that if you were getting a correct and excellent amounts of vitamin D, that your incidence of melanomas would actually be lower, which would be completely opposite to what I would have thought.
Okay.
And they're not sure exactly why that is, except that it seems like if you have the sun hitting your skin, or if you're getting it from a nutritional source, the body can convert it to activated vitamin D.
Okay.
And when you have activated vitamin D in your body, it acts as an excellent control center to help the body stop from the aggressive cell proliferation, which you would have in all the different types of cancers that Tim just mentioned, including skin cancer.
Interesting.
And so even though we realize that sunburn is definitely something to avoid for skin cancer, but it's equally true that correct and adequate amounts of sunshine actually work as a preventive for skin cancer. A very fun and interesting research item also is a study they did on a Navy aircraft carrier, and they found that there was higher incidence of melanomas in the people working below decks than in the people working above decks.
So the people who were below deck, who were not getting much sun at all, had higher rates of melanoma than those who were above deck getting lots of melanoma.
Exactly.
Interesting.
Which is very interesting.
Very interesting. Now, I've heard that vitamin D deficiency or that sort of thing is also somewhat connected to diabetes?
It is. Okay. As mentioned earlier, the good amounts of vitamin D in your childhood, before ages 12 to 15, seem to be very protective against multiple sclerosis. It also seems to be protective against diabetes 1 and rheumatoid arthritis.
Wow.
So it seems to help the body's immune system take a correct stance. With autoimmune diseases, the immune system can somehow start chasing down the things that are not problems. So it seems to calm down the immune system to help us avoid those diseases, and yet it helps start all the good action against things like tuberculosis and against cancers, which is a remarkable thing.
It helps the immune system in some way differentiate between what's harmful and what's not. Our own bodies sometimes fight against themselves, and that's the case with type 1 diabetes, which is an autoimmune disease, and the rheumatoid arthritis. Type 2 diabetes is different, but vitamin D seems to help there with insulin metabolism. Using insulin to metabolize sugar, it makes the insulin work better. So we get reduced levels of type 2 diabetes with adequate sunshine as well, but a completely different mechanism through insulin sensitivity.
Interesting. Now, vitamin D is also connected to the body's ability to use calcium somehow?
Right, it is. Would you like to explain that?
Vitamin D, of course, is very important for the prevention of osteoporosis. We often just think about the bones, but we found in the elderly that it's also important in muscle strength. And many of our elderly that are vitamin D deficient, if they increase their vitamin D level, either through supplementation or through sunshine, will find that their muscles actually get stronger and they have a lower risk of fall. We worry about bones breaking from falls. Well, let's not only strengthen our bones, but let's strengthen our muscles so that we don't fall. Vitamin D is, of course, very essential for calcium movement into the structure of the bone. And if you have plenty of calcium and no vitamin D, you're not going to have strong bones. You need both of them. So it's very important. But for years, we've just thought about osteoporosis and vitamin D. But vitamin D has many other effects, as we're finding out. Very important.
So I've heard that the sunshine we're exposed to during the summer months is actually more meaningful or somehow better for us than that which we're exposed to in the winter. Is there truth to that? And then how does that affect those of us who live in Maine in this, high latitude?
You're exactly right, Cheryl. From November 7 to February 7, we absorb very little vitamin D from the sun. No question about that. Fortunately, our bodies can store vitamin D for quite a long time. They've done studies, though, in women who take vacations in the sun in the winter. They have much better bones than those that don't. So, you gentlemen out there, if your wife says, let's head south for, 2 weeks in the winter, I'm sorry, there's some good health reasons to do that.